Are you looking for help for your food addiction and you don't know where to start? Welcome to the series, The Food Addiction Frontlines, where we uncover the expertise and services available for overcoming food addiction. I'm Dr. Vera Tarman, an addiction physician specializing in sugar and ultra-processed food addiction. In each 50-minute episode, we meet leading experts making a difference in this field. They will share their journey, their training, the unique services they offer for all who struggle with food addiction, so that you can find the treatment that is best for you. Today, we speak with Brian Baumal. Welcome, Brian.
Thank you, Vera. Nice to be here. Nice to see you again.
What inspired you to specialize in the field of food addiction or take that on as part of your practice?
Yeah, almost 10 years ago, I decided to go into the field of weight management because I had lost a lot of weight, was a psychotherapist, and I thought this would be a good specialization based on my experience. I had to educate myself on what the psychological treatments were for weight management. What I came across was an addictive model for eating, meeting a gentleman named Tony Vasallo who introduced me to you. And from there, I just adopted food addiction as a way of working with people whom I assess to have that condition.
What training and expertise do you have in therapy and then also specifically in food addiction?
Good question. I have a certification from the Gestalt Institute of Toronto and am registered as a registered psychotherapist with the College of Registered Psychotherapists of Ontario, CRPO. My training is in Gestalt, a branch of psychodynamic therapy. Psychodynamic means there are dynamics that go on for us psychologically, like we often have opposing voices in our head. Eat the food, don't eat the food, eat a little bit of it. And that's a very simplistic example, but I have ways of going in and working with those voices in ways or those thoughts. That includes getting very deep in those thoughts and voices, like how long have they been there? Whose voice does it echo? Does it sound familiar? Does it sound familiar to you, like a person in your life or a fictional character?
Specifically around food addiction.
Actually use a lot of your teachings and trainings. I've listened to you, I've read your books, I've looked at other food addiction professionals. Take what you offer and boil that down into my own practice and come up with various assessment and treatment tools that way. We met in London last year at the Food Addiction Conference. We meet about once or twice a year, if not more, at various conferences. So I'm always educated on the latest developments in food addiction.
Tell me specifically what services you provide for people struggling with food addiction.
I take a psychotherapeutic approach to food addiction. Before I get into the psychotherapy part of it, we identify and eliminate trigger foods accordingly or assess for volume addiction.
Do you provide like a food plan?
I will tell people what foods to avoid based on their trigger foods, because that's my area of psychology. A nutrition plan that focuses on losing weight and or sort of determining foods that may set people off, I would refer to various nutritionists. I have a holistic nutritionist who specializes in food addiction and can really get into the fine points of whether a certain carbohydrate would or would not trigger someone. What I do for people is I use an addiction treatment model. And that means often finding a purpose in life that is greater than yourself. That's one thing I do. I help people set boundaries around food, whether that be weighing their food, certain times of eating certain places, and it can get really creative. That's where the therapy comes in, because the boundaries have to be specific to that person. I don't want to impose them, or we work together to create those boundaries. The third thing that I do is I introduce people to their addictive voice if they don't know it already, because that voice, quite frankly, is just hell. to have to live with and deal with. So we work at recognizing what that voice is and how manipulative it could be. And that gets into the psychodynamic exploration of that voice.
What would you say is your strength for somebody who's searching for a therapist in food addiction?
My strength is actually a couple of things: correctly assessing that someone has a food addiction versus binge eating disorder or just, a problematic relationship with food. We want to make sure we're delivering the right treatment to the right people. So my assessment gets really deep in there. Some of the unique questions I ask: is your relationship with food similar to a person you may know that has an addiction to wine or gambling? And now what I'm asking is, the voice in your head that tells you to eat, does it get louder? Like, does it actually increase in volume?
Yeah.
Or does it change its messages to the point where it may say, you know what? If you don't feed me, you are a bad person. You're a horrible, rotten person if you don't feed me. That's very different than the binge eating or disorder voice, which just says eat, 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 or eat for comfort, eat to reduce pain, eat because you've done it before. That's where my strength lies, is getting the right assessment to the right people.
It sounds like you try to dig deeper into the situation as well.
Absolutely, I do. I can give you one example right now.
Yeah.
I'm working with someone who has bulimic eating patterns. I don't say bulimia, I say bulimic eating patterns. Bulimia involves two things. It involves an overeating and then a purge of that food sometimes. I have a patient, I believe, where the overeating is caused by a food addiction. And that's completely different form of treatment than if you treat bulimia as an eating disorder. My specialty is getting the right compassionate treatment to the right people. And I have to tell you, when I say someone is a food addict, I would say at least half the time, people thank God, and I truly mean this, thank God that someone has really, really heard
Mhm.
them. That's not a cure. That certainly opens the door to exploring this food addiction in a way they can't with other practitioners who
Yeah.
don't recognize it.
Any limitations that you want people to know about?
As a registered psychotherapist, I can't prescribe meds and I can't formally diagnose either. That really doesn't play a role in food addiction, because food addiction, as of yet, not a formal diagnosis. I do not give eating plans to people, as we say. For me, that's a positive, because I am not a nutrition. People out there are inundated from those that have no training in nutrition. I would rather direct them to an appropriate person who understands the nutrition of food addiction. So it's a little bit of a limitation.
Do you deal with co-occurring issues? A person who has anxiety, depression?
Absolutely, absolutely, I do. And some of the more common some of the more common issues would be anxiety, depression, OCD, bipolar disorder, personality disorder. Those are some of the more frequent ones. So I am very well versed in that. And we talk about where we're going to focus first and whether the food addiction is intermingled in that.
Right.
Oftentimes, the two are very separate, but someone with depression, for example, may just feel sad and may have the food addiction cover up that sadness. But food addiction is much more, as you know, than just covering up sadness. It is a compulsion to eat.
Yeah.
So the sadness may trigger that compulsion, but the compulsion is there whether the person is sad or not.
Family issue. Do you work with the family, work with 12-step groups?
I don't work with families. I wish I did, because one of the biggest issues that food addicts face is their food environment, number one. and family members who don't understand the addictive model. Of course, you can have a piece of cake. It's your birthday. I demand you have a piece of cake. We know how wrong that is. So I have always offered to speak to a family member, but not necessarily deal with a family member in that case. And you asked about another
A 12
service.
12-step, just outside
Yeah.
resources.
I will always recommend a 12-step program to my patients for a couple of reasons. One, I believe it's my obligation as a therapist to do so. Number two, a lot of their treatment aligns with with the way I work. I can work in conjunction with someone who's in a 12-step program. Works incredibly well. It's just like magic for them. So absolutely, I recommend them, and I do work with them.
What are some challenges that you've encountered in treatment?
Addressing that addictive voice and to let people know that it's not, in my view, I'm open to interpretation, it is not going to go away. And the way around that voice is to structure your environment so that it becomes easier to say no in terms of food rules and purpose in life that is greater than the food addiction, where you can say, sorry, food addiction, I am going boating this weekend. I am going ice fishing this weekend, and that is my priority. It's very difficult to get people to shift to that mindset. And of course, there are relapses along the way. And I tell people there are going to be relapses, and we learn humility at this point. We learn that this is a lifelong condition. I think humility is important in any food, be it binge eating disorder, restrictive, and certainly food addiction.
What about you? You're working in a field that is weight management. It's often very frustrating. How do you deal with your own issues so that you don't get in the way of your clients?
Right. I believe I have lifelong food issues. I don't want to say abandon all hope of that, but the way I explain it to people is if you got into a car accident, you're going to have trouble getting into that car for a while. It's going to take you a while to acclimatize to it. Unfortunately, we have to eat 3 times a day. We can avoid travel. We are bombarded with food advertising and food everywhere. So we are triggered all the time, constantly make decisions many times a day about how I manage myself. Today, I will just tell you, today, for the first time ever, I ran out of a workout because I had a work issue to deal with. I'm okay with that. If I make a mistake, if I have to leave a workout early, it doesn't rewrite my code to make me a bad person. If you slip up, the potential is to go immediately back to where you were before. I have learned to address that in myself, and I teach my clients how to deal with that too.
How can people find out more about you?
I have a website now called aliva.com, ALIVA psychotherapy.com. On that website, there will be a special page dedicated to people with food addiction when they are able to overcome or manage a food addiction. It is truly life-changing for them and very pleasurable for me. It's why I keep doing what I do.
Oh, great. Is there anything that I didn't ask that you would like to say to showcase your work?
I want to be spontaneous. I want to really recognize the person in the moment, and that recognition and spontaneity can create a very fun and lively session where the person can get insights into themselves. So I believe that's a specialty of mine, having people get the insights on their own, but certainly I'm very aware of the theory. So if I have to come in and say, you need to set boundaries around this, and they're not sort of getting there, I can do that too.
You know, you're spoken like a true Gestalt therapist.
I'm glad you know the modality.
Yeah. So any last words of hope to leave the listener?
There is hope. People, when I tell them they have a food addiction, people break down and cry. They just to hear that someone finally gets it. And that, I would say, is the biggest hope that I provide. But honestly, the broader hope that there are professionals working to really advocate for food addiction. And we're starting to see it slowly. You have interviewed some die-hard eating disorder people whom I respect very much that are now starting to say, yeah, there's some food addiction stuff going on. So once it gets broadened out by people like you and hopefully me, there will be more hope.
Yeah, that's a great way to end. Thank you so much, Brian.
Vera, it is always my pleasure.
Is the enemy corrupting the minds of the teens, expelling you not to foresee. Your body's your temple, your mind is your key to a life tapped into happiness. Have it, don't dream it. If only you could see it. It's all